Hey guys, I wanted to come to you today. We're just going to do a little video in service. You can watch this, you can listen to it. I am going to email you guys all of the handouts that are needed that I discussed in this video with you guys via email and access. So make sure that you're looking for that. Coming to you from my bedroom, so working from home. Hope all you guys are safe and well and have plenty of toilet paper. Crazy times out there. So a couple of things that I wanted to go over with you first. I'm going to share my screen with you, so hopefully you can see it. We have updated our emergency preparedness plan with a specific section for COVID-19. So I do want to go over that with you. I will email you the paper copy of it, but we're going to go over it um, right now. So I'm going to come over here and share my screen with you guys. So let's see, let me find it. Probably down here in the P's. All right. So here we go. So this is our updated pandemic COVID-19 emergency plan insert. Okay. So just going over it really quickly, going to hit the high points with you guys, basically talking about the administrative staff will monitor all the local news broadcasts, CDC website, HICSA websites for changes for real-time changes as they occur. Skilled nursing staff will educate patients and their caregivers on the signs and symptoms of COVID-19. Symptoms to be covered will include fever, cough, and shortness of breath. You guys all should have received patient teaching packets for your patient's home folders last week. Make sure that those are in all of the patient's home folders. If you do not have one for your patient, then you need to check back with the office, check in with Melissa. She's going to work every day in the morning from 8 to 4 there at the office, making sure stuff gets scanned in. And she was also the ones that copied these things for you guys. What we did, we made one for every patient and we sent it with the staff member that was seeing them next. So it might have been that therapy took it out and put it in their home folder, but please make sure that all your patients have this so you can go over it with them. Nursing, you need to be educating your patients on the signs and symptoms. With that being said, you need to document that you educated them. If we didn't document it, it did not happen. All personnel will participate in the prevention of patient-to-patient and patient-to-staff transmission by instructing and utilizing the appropriate infection control procedures with the use of appropriate hand hygiene, equipment cleaning, and PPE. So super important is that we are cleaning our equipment between every patient and before it goes back into our bag. Make sure that you are using wax paper and or trash bag barriers. If we need to get some more of that, we can. There's not a shortage on wax paper yet that we're aware of. So there was a whole box of it in the supply closet at the office, and it's still there. Make sure that you have that on hand. We are using masks and gloves with every patient. We do have gloves. All of the PPE is at my house, 106 Willow Bay Drive. So you need to contact me, swing by here and pick it up. Let me know you need some. I'll leave it for you when I go to the office. I go by there every day to pick stuff up and drop stuff off. So we are using masks and gloves with every patient. Now, we gave you 2 masks last week. If you need more masks, let me know. We are down to 8 masks as of today. We are in the process of working to make you guys 4-layer fabric mask. I know that is not ideal, but it is better than nothing. So let me know what you need. I have it here in my house. You're gonna have to come by and get it, but make sure that you're using good hand hygiene. We have plenty of hand sanitizer. So you're cleaning your equipment with spray and wipes. At this time, we do have spray and wipes. You just don't want to go crazy and waste it, but make sure that you are using it appropriately and that you are wearing gloves and masks in every patient house. Okay. When the pandemic coronavirus is in our community, patients will be contacted prior to home visit to determine if the members of the household have coronavirus symptoms. So we are screening those patients with a phone call prior to every visit, not only the patient, but the people in their household as well. So if the visit is considered essential, which your visits at this time, all visits except for home health aide supervisory visits are considered essential. We got that clarification from the HICSA division yesterday through DADS. So the only thing that we're allowed to do via telehealth or via phone right now are home health aide sup visits. We don't even have any home health aide patients at this time. So if the visit is considered essential, you'll follow the appropriate infection control procedures, okay? If it's non-essential, then we'll postpone it or do it via telehealth or phone calls at this time. Nursing staff will attempt to limit contact between infected individuals living in the same household by instructing the families to isolate infected individuals as much as possible. We do not have any active infections in Angelina County that are confirmed at this time. I'm sure there are some here. So we want to make sure that we're teaching those patients, people that are showing symptoms that have been confirmed, they are isolating in one area of the house. Agency staff should instruct patients and their caregivers on respiratory hygiene and cough etiquette and encourage the infected individual to wear a mask if leaving the home. Respiratory hygiene and cough etiquette will include covering the nose or mouth with a tissue when coughing and disposing of the used tissue, using masks when they can be tolerated and are appropriate, covering the nose and mouth in the crook of the arm when a tissue is not available, hand hygiene after contact with secretions, and spatial separation of more than 3 feet if possible. 6 feet is recommended. Okay, that's just the general plan, okay? The infection control for home health personnel, infection control practices for pandemic coronavirus are the same as for other human influenza viruses and primarily involve the application of standard and droplet precautions. PPE for standard and droplet precautions will be used to prevent direct contact with a patient known to have the pandemic coronavirus. Care for patients will be performed using procedure masks, gloves, and gowns. We have lots of gowns. So if at any time we do ever actually have an active case, we're going to reserve the few N95 masks that we have for that patient. We'll start to use gowns, and we'll also use, obviously, gloves. Mask, you'll wear a mask when entering the home. These are for confirmed cases, but keep in mind, we're doing this for everybody. But for a confirmed case, you're wearing an N95 mask when entering the home. Masks will be changed when they become moist. Do not leave a used mask dangling around the neck. Upon touching or discarding a used mask, staff will perform hand hygiene. Now, keeping in mind there is a huge mask shortage. So if we have an active patient that comes on service, we will have to reuse masks. We will label them. We will leave them outside of the home. We will not put them in our cars and transport them around. We're going to put them in bags and label them. Excuse me. Gloves, I don't have corona. Gloves, patient care gloves will be worn for contact with blood, body fluids, and respiratory secretion. Gloves will be discarded after use and hand hygiene will be performed. Gowns will be worn while performing patient care if the patient has a known coronavirus infection. Gowns will be worn only once and then discarded. Moose. Sorry, my work from home coworker is not mindful of my meeting. Hand hygiene will be performed following the removal of the gown. A face shield will be worn if there's an anticipation of spray or splatter. We do have masks that have the face shields on. Teaching, there's a whole section on this page about teaching. I need you to make sure that you go over that with the caregivers, the people that are providing care in the home for the patient of patients with active infection. So that's sections 1 through 9. Just some tips on that. So I'm going to let you guys read that on your own. I'm not going to go over that with you one by one. I did also want to talk to you. We got some new guidance from the Department of Health and Human Services last night for HICSs, excluding inpatient hospices. So we are required to comply with the state and federal laws, rules, and regulations. Still at this time, due to the escalating situation of the COVID-19 coronavirus, the Health and Human Services Commission issued guidance to program providers to reduce the risk of spreading the virus to individuals served. So here, these are things that we're already doing. We've been doing them for a couple of weeks now. Moose, stop. So these are things that we're already doing. So employees that are providing care to clients in their own homes or in residential settings, such as assisted living facilities, should be screened prior to the visit being performed for any signs or symptoms of respiratory infections, such as cough, shortness of breath, fever. They say sore throat as well. So if they're having any of these, and we've had a couple, like I know Rhonda's reached out to me, we have to ascertain if they're symptoms of the East Texas pollen allergy stuff going on, or an upper respiratory infection, or possibly could it be COVID-19? So we're asking them, do they have any of the signs and symptoms? Have they had contact in the last 14 days with someone who has a confirmed diagnosis of COVID-19 or is under investigation or ill from a respiratory illness? Have they traveled within the previous 14 days to a country with sustained community transmission? And now that does include the US. So have they gone to places like New York or Washington are the two hot spots right now in the US. So we need to ask that. So we're asking that before every visit. So even if you're seeing a patient like twice a week, you still have to call them twice a week. And you have to document the screening of that. Now, I have created you guys a template in Access to document that, okay? So you must communicate with the client before a scheduled visit, either by phone, text message, or video conference, and conduct the same screening that is required for HICSA staff. At the bottom of this letter is what this letter says. So I have built your template in Access. If you'll go and you'll look in Access, I'm still sharing my screen with you guys. I'm just gonna view a template list. When you come down, it is the Agape COVID-19 screening documentation. This is what it looks like. Patient screened to be a phone prior to visit using the following questions. All questions were answered as no. Now, If they're not answered as no, then you got to make some changes here. You can say all were answered as no, except for question 1, okay? Or except for question 2, all right? So if they have, say they had the 2 of the symptoms except for no fever, conference with administration, proceeded with visit due to essential nature of the visit or whatever, using the appropriate PPE. And did we need to notify the physician? Have we, if they're a therapy patient, did we notify nursing so nursing can intervene? We just got to document and show the appropriate follow-up there. So that's what that looks like there. Okay, so going on down this letter, the response to the screening, if the client of the household member meets the screening criteria, the agency must determine if a home visit requires essential services critical to the health and safety of the client or non-essential services. Okay, visits that require non-essential services. Now, keeping in mind, for us, for licensed home health agencies right now, this is only home health aide supervisory visits. Okay. I would say therapy supervisory visits, but those are always attached to a visit. Okay. So the visit part, like the therapy screening part, as far as evaluation, reevaluation, those things are considered essential. So you would do it and you do the visit anyway. So as of right now, we're only considering non-essential things for us to be home health aide supervisory visits. They're looking at possibly making a recertification visits non-essential because it's just OASIS data collection. Okay. If the visit requires essential services such as medication administration by the nurse, wound care, etc., staff should visit the client to provide the essential service and use the appropriate personal protective equipment during the visit as indicated with guidance from the CDC or the Department of State Health Services. The HICSAs should document and communicate missed visits with the client's attending physician as appropriate to the plan of care, care plan, or individualized service plan. Until further notice, agencies may use alternate means of communication, such as virtual communications, to continue contact with clients for non-essential services and to provide certain essential services, such as therapies, as determined by the physician and interdisciplinary team. Now, at this time, TAC has asked for guidance. At this time, visits are not billable. Skilled visits are not billable under the telehealth benefit or by FaceTime or by phone. So we are still conducting visits unless we get some further clarification from that. Okay. So we have had a couple of patients that are requesting not to be seen. Rena Lemire is one of them. I got a phone call that Mitty Ray wants to be discharged. What we're doing is I'm calling Mitty Ray today. We're going to actually offer to keep these patients on service and make phone contact with them weekly because we want to remain a resource for them should they need us in this scary time. And these patients are scared. I know they're scared of us coming in and out of their home. So we want to make sure that we are soothing their fears, make sure they know that we are taking every precaution as needed. The next step in this letter is about client education. So it says that we have to make sure and provide accurate and patient control information to clients to ensure their client health and safety. This includes direction of the client to screen individuals who would enter their home, including communication prior to the visit, self-isolation if they are exhibiting signs and symptoms of infection, hand washing, use of hand sanitizers, and disinfection of high-use areas in the home. Our teaching packet we sent out last week does cover all of this, okay? Then it goes on to talk about policies and procedures. The first one is to ensure that we have a plan in place, and we do, that we're following guidance issued by the appropriate authorities, and we are ensuring infection control policies are updated to align with CDC guidelines and guidance to address the use of PPE. Now, there's a huge PPE shortage. Everybody's aware of that. They're not going to penalize us if we don't have PPE for you guys. Just simply because we can't get it. And so we are trying. I appreciate all of you who have reached out with the resources. I know Sheridan's emailed me, texted me about a friend who's a rep. I've reached out to her. Trina's husband is, or soon-to-be husband is helping us get some stuff from Walmart as it comes in. So I appreciate each and every one of you. As you see something, you're snagging it or you're texting me and Angie, and we appreciate that because we want to make sure and have all the things for you guys that you need. So please keep doing that. And so we've done all of that. Going on down, a lot of this is just stuff for me. Number 7 does pertain to you guys. Notify the client's physician immediately if the client exhibits symptoms such as fever, cough, or shortness of breath. And so we may have to help these patients do a telehealth visit with their doctor. So it's super important if your patient is exhibiting any kinds of symptoms while you're in the home, call into the office and say, I'm here now. I can set up a telehealth visit with my phone or my tablet or whatever. If you need a tablet from the office, we have a couple of extra tablets. You guys can use my personal iPad. I'll let you use that while we're going through all this craziness. But because these little people, sometimes they're not able to do telehealth. If you think it's somebody that like, oh, they're not going to be able to do telehealth, then let's plan to help them with our equipment. Oh, excuse me, y'all. Okay. Um, and then it's just resources and contact information. So I'm going to attach this letter as well to you guys so you can review it if you want to. The main thing I want you to review, though, is our pandemic emergency plan. We talked about patient screening and documentation. You're calling your patient before every visit, asking them the appropriate screening questions, and then documenting in your note that you did screen them using our template. Make sure that you are all texting me your temperatures. I haven't gotten very many temperatures today, so please make sure that you are texting those to me prior to seeing patients. Now, if you're a person who only works for Agape 1 or 2 days a week, you don't have to text me your temperature every day. I just want to know it on the day that you're seeing patients for Agape. Um, Make sure that you do that before you see patients, please. If you forget, send it to me as soon as you remember, but please, I want to make sure that we're monitoring our temperatures. We have doctors asking us, what are you guys doing to protect our patients? And so we've given them a whole list of things. And so we want to make sure that we really are doing them. We talked a little bit about PPE a few minutes ago. We do have PPE. It is here at my house. Once again, my address is 106 Willow Bay Drive here in Lufkin. It's off of White House. It's right here in town. If you need to swing by here, just shoot me a text, give me a heads up that you're coming by, and I'll have ready what you need. I have all of the gloves that we have. I have the few masks that we have left. I have the micro kill wipes, and I have the spray. So make sure that you're coming by here to get those things. Please don't go without because you think we don't have any. They're here at my house. We just had somebody swap all of our N95 masks that we had. We left us with just one. So I'm keeping those here for safekeeping at this time. So I'm sorry that everybody gets punished for the actions of one. Case conference. We're going to have case conference Tuesday morning at 8:30. We're going to do it via Zoom. And so we did this last week. It worked really well. We had a big case conference that we got finished in an hour. So you guys were really great to dial in and listen and keep disruptions to a minimum. And so we understand that people's kids are home. Please don't freak out if your kids are there. And we understand the kids are going to come up and talk and, oh, I want to be on the video. That's totally fine. We just appreciate we all have to do what we can right now in these crazy times. So please don't worry if your kids are there or try to make alternate arrangements for them. It's fine. We all have kids. Lynn's going to email you guys the case conference list today so you guys can look at it and kind of have a heads up again. But the office, we are only running a skeleton crew. Like I'm working from home and just popping in and out up there. So it'll be more of us on Zoom this time. So we want to make sure and keep disruption to a minimum if we can. We talked about patients being on hold by request. And so I think that's about it. I'm going to send you guys an email with the documents that I referenced here. I'm going to attach once again our infection control policies and our infection control plan, our hand hygiene policy. I'm also going to attach to you the sequencing for donning and doffing PPE. So I've sent those out already twice in the last couple of weeks. I'm going to send them out again. You can't ever have too many review courses. So if you have any questions, I have my phone. Please contact me. You guys stay safe out there and take care of each other. See you soon.